All right, today we're going to talk about turf toe. Turf toe is pretty common in football, and it usually affects the big toe joint. It occurs when the toe is hyperextended, typically when the athlete's foot is planted on the ground and they are suddenly forced to stop or change direction. This places a significant amount of stress on the big toe joint, resulting in injury. Turf toe can range from mild to severe with varying outcomes over time. Specifically, the area in which is being disrupted is going to be what's called the plantar plate. Now, this is a plate that is thick, it's fibrous, it's a ligament located on the bottom or plantar side of the MTP or metatarsophalangeal joint, and this helps stabilize the joint and prevents excessive extension of the big toe. Now, there are medial and lateral ligaments that are involved that I'll show you right here on this animation, and it's these ligaments that can become stretched, torn, partially torn, or completely torn, depending on the severity of the injury. The grade of the injury, mild, moderate, or severe, is often determined by the extent of the damage to these ligaments. It's important to note that the plantar complex ligaments play a crucial role in maintaining the stability of the big toe joint and allowing it to flex and extend properly. Injuries to these ligaments can lead to pain, swelling, decreased function of the affected toe. Proper imaging and proper diagnosis is required. So what are the levels of turf toe? Grade 1 or mild. This is the least severe form of turf toe. The ligaments around the big toe are stretched, but they aren't torn. The symptoms include mild pain, swelling, limited range of motion. Recovery from this is usually pretty quick, few weeks with conservative treatment. Grade 2 or moderate. In a grade 2 turf toe, the ligaments around the big toe are only partially torn. The symptoms are a little bit more pronounced, including moderate pain, swelling, difficulty bearing weight on the affected foot. Recovery for this can take several weeks to a few months, depending on the treatment. And then finally, grade 3 or the most severe. The grade 3 turf toe is the most severe form. The ligaments around the big toe are completely torn, resulting in significant instability, which has severe pain, swelling, loss of function. It's pretty evident. Recovery for this can take several months, and in some cases, surgery is required. What is the timeline and outcomes for this? Well, immediately after sustaining a turf toe, the immediate response usually involves RICE or rest, ice, compression, elevation. This helps manage the pain, the swelling, and immobilization may be necessary, and crutches can be used to assist with weight bearing. After that, the first and second week, a mild or grade 1 injury may show significant improvement with rest, gentle range of motion exercises, and anti-inflammatory medication. Moderate and severe cases may still require immobilization. The next 4 to 6 weeks, grade 2 injuries often require a more extended recovery period. Physical therapy can be beneficial for regaining strength and flexibility. Severe grade 3 cases may still be in the early stages of recovery. Over the next 2 to 3 months, the grade 3 turf toe injury may require several months of recovery. Surgery may be considered for cases that do not respond to conservative treatment. Thinking about the long-term outcomes of turf toe, it depends on the severity of the injury and the effectiveness of the treatment. Mild cases may result in a full recovery with minimal long-term effects. Moderate cases may experience occasional discomfort or stiffness, while severe cases can have long-term joint instability and the potential for arthritis. It's important to note that the timeline and outcome can vary between individuals, and that proper medical evaluation and treatment are crucial for best results. Rehabilitation under the guidance of a healthcare professional, physical therapist, is essential to restore function and prevent long-term outcomes. That is it for the review of the turf toe injuries. If your player has this, I feel for them. Hopefully they can make a speedy recovery. Hopefully this information has brought you value. So click that like button if you don't mind, and subscribe to the channel if you like this sort of thing. I'll see you in the next one.